Hello, I'm Kearni Warren with Health and Wellness. Today I'm speaking with Dr. Elizabeth Fitzgerald from Abington Dermatology, which is a private practice located in Jenkintown, Pennsylvania. Today we'll talk about the dangers and preventions of skin cancer. Dr. Fitzgerald, can you describe to us what skin cancer is and what is the most common form of skin cancer that you see in your office?
Certainly. Skin cancer are skin growths that occur on the body that are slow-growing, typically lesions that occur mostly from years of sun damage. We see them typically on facial skin as the number one location, and the most common types we see are called a basal and a squamous cell type.
Okay. Now, I was reading today where a new trend is having tanning salon beds or tanning beds located on college campuses. I read where nearly half of 125 top colleges and universities have them on campus and off-campus housing. What is your opinion about that? How do you feel about that?
It's a really huge public health issue. The American Academy of Dermatology, we're trying to educate the population that the ultraviolet that you receive in a tanning salon creates a lot of damage to the skin. And there are studies that have shown that tanning beds exposure has increased the risk for melanoma, which is the most serious form of skin cancer we see. So we have seen over the past several years an increase in the number of young women with a melanoma type of skin cancer, and we are seeing this direct relationship to the use of tanning salons.
Wow. So in previous years, you would see patients who would come in with a history of exposure to sun and UV rays, and now you're saying that due to this new trend, in addition to younger people staying out in the sun longer, you're seeing more of a younger demographic coming in with skin cancer issues.
We see typically the population most at risk for skin cancer has always been a fair-skinned population with years of accumulation of sun exposure. We see a lot in an older age group, especially fair skin. Now we are seeing this younger population, mostly female patients who are presenting to us with these serious forms of skin cancer. So it is something that we've definitely seen more of over roughly the last 5 to 7 years.
Okay. Now, how do you diagnose skin cancer, and what are some of the symptoms?
So typically, the most common types of skin cancer, again, are a basal and a squamous cell type. The melanoma type is the third type of skin cancer we also see fairly often, and it is the most serious. So typically, the warning signs of skin cancer would be any new skin growth that seems to be growing quickly, if a skin growth bleeds or scabs repeatedly and doesn't heal, looks very dark and irregular as compared to other moles or freckles, or even a red, crusty, or scabby spot that's not healing. So typically we recommend that people have their skin examined, and hopefully we're educating people to examine their own skin for those changes.
Okay. And how would we prevent, what are some of the preventions that we can take to limit the exposure to the sun and UV
So
rays?
again, we know that outdoor sun exposure over time is what creates most damage to our skin, which increases our risk for skin cancer. So what we're recommending is to go out earlier and later in the day. If you are going to be out in the sun, wear protective clothing. Hats, especially with a wide brim. Sunglasses are helpful. Of course, sitting in the shade if there's that opportunity. But also, we recommend trying to wear a sunblock on any exposed skin. And we recommend looking for a sunblock that says that it's broad spectrum with an SPF of 30 or higher, and reapplying every 2 hours while you're out.
Okay. Now, can you describe to us or tell us what does the SPF
So basically, the sun protection factor means that's how long you are able to stay out in the sun with protection. So the numbers, basically what we're asking people to look for is roughly an SPF of 30 or higher. The higher you go, you don't get a tremendous amount of additional protection, so it's not necessary. It's certainly not something that is a problem to use, however. So, but the key is to use it and reapply it every 2 hours.
Okay. Now, I know many people typically use sunscreen when they know that they're going to the beach or they know that they're going to be outdoors for a long period of time. But also now, a lot of products, makeup products, they include SPF in the product. So do you suggest people buy products where it might be easier for them to remember to wear the sunscreen?
Yeah, we feel it's an excellent idea to make it part of a habit. A lot of cosmetics do now have the SPF built in. So what we tend to recommend is every morning people try to apply some kind of sun protection product, like under makeup. So there are moisturizers that have the sunscreen built in. For men, we recommend after shaving or showering, trying to put a moisturizer on with the sun protection, because even if we're not going to the beach, we're still getting ultraviolet. So driving, things like that, we're still able to get it. So this does give us protection every day.
Okay, I know when you speak about driving, when you're driving, the sun is usually shining on the left side because it's the closest to the window. Does that have any type of effect on?
We do see a lot more sun-related skin issues and damage on the left side because of that. The ultraviolet that comes through the glass actually is very similar to what we see in the tanning salon. So you may not get a sunburning from it, but you do get damage over time. So we've seen a lot of people who drove extensively for a living or spent a lot of time in the car have a lot more changes on the left side of their body.
Is there a difference between the exposure directly from the sun versus tanning beds?
The ultraviolet we get in sun is a mix of a couple different types of rays. So we can get sunburning and deep damage from sunlight. The ultraviolet you find in a tanning salon doesn't tend to cause as much sunburning, but we do see more deep damage from it. So that's why I think a lot of people will say, well, they go to the tanning salon and may not see any burning, so they feel that it's a safe option, but we know that they're getting deep damage to the skin, which ultimately can increase the risk for skin cancer.
So when someone gets sunburn or receives a suntan, is that need for worry?
It is a sign of damage. Sunburning is an acute event. And we know that even just one sunburn can increase the risk for skin cancer over a lifetime because it does cause damage to the cells. Sun tanning over time, we know is a sign of chronic sun exposure. So even though you may not sunburn, we know you're still getting ultraviolet that over time can again cause damage to the cells.
Okay, now what do you do to treat someone who has skin cancer?
So it all depends on the size, the location. Typically, a lot of small superficial skin cancers are treated with surgical procedures. So there's just simple removal. There are more intricate types of surgeries if it's, say, affecting an area like the eyelid. We also can use top creams that are almost like a chemotherapy type agent that can also treat types of skin cancers if they happen to be a patch or a large area of skin. Some patients will take medications by mouth or also receive radiation, depending again on the size, the location, the difficulty in treating. So there's kind of a wide spectrum of treatment options.
Okay, and do you have any other suggestions for those of us who are out in the sun or like to sunbathe or to just take in the sun?
So the reality is we'd all love to go to the beach. And so it's part of life, and we want people to enjoy their lives. We want people to use common sense. That I see a lot of adults, and in my age group, we laid out in the sun. And so now we see a tremendous number of people with skin cancer because of those behaviors. So what we're recommending is just try to go out. If you want to go out earlier in the day. Again, wear the protective clothing, sit under an umbrella, reapply a broad spectrum sunblock every couple hours. Again, we're just trying to limit the damage, and still people can certainly enjoy a beach vacation without getting a tremendous amount of damage to their skin.
Okay, now you mentioned about seeing a change in the skin if there's an unusual looking mole or if something has, if it's scabbed. Are there any other physical symptoms that a person would have other than just
Other
on
than
the
a
skin?
visible lesion,
Yes.
typically it's something that's visible on the skin.
Okay.
So most skin cancers grow fairly slowly over time.
Okay.
So what we're recommending, especially for an adult population who has either had a lot of sun or if there's been tanning salon use, is to have their skin checked roughly once a year.
Okay.
Also, again, trying to educate them what to look for. And it usually is a noticeable spot on the skin that is changing over time.
Okay. Well, I thank you so much for
Certainly.
speaking with us today.
Certainly.
We've learned a lot about the preventions and dangers of skin cancer. So thank you very much.
It was my pleasure.
Thank you.
Thank you so much.
Thank you.